Okay, so just going to share my screen. 1 second. Good. So hopefully everybody will be able to see this. Great. Brilliant. So I just want to say a big thank you to the Allergy and Free From Show for inviting me to raise awareness of celiac disease. And today I just want to give a bit of a brief presentation about celiac disease, giving an overview. And my name is Cristian Costas Batlle. I am a UK gastroenterology dietitian with a really big special interest in celiac disease. So I mainly practice over in the UK. Most of the patients I see have celiac disease, but also other digestive conditions. And I've been working as a dietitian for just over 5 years now. So today, really, I want to give an overview of celiac disease, explain a bit more about what it is, explain more about the symptoms so we can help more people get diagnosed. And I'm also going to talk a bit about the importance of management of celiac disease and how we can get help from the right health professionals with that. So hopefully it'll be a bit of an overview for people who don't have celiac disease, but also for people who do have celiac disease. So hopefully you'll go with quite a bit of useful information after this session. So I guess it's good to first go into celiac disease a bit more in detail and define it. So celiac disease is actually not an allergy and it's not an intolerance. It's an autoimmune condition. So this means that when someone has celiac disease and they eat gluten, gluten will attack, the body will attack itself, sorry, and it will mainly happen at the height of the small intestine, just after the stomach. So what happens is that if someone has celiac disease and they eat gluten, gluten comes down and this reaches the lining of the small intestine. And this is where it pretty much causes havoc for that person because it causes a whole cascade of changes there. And one of the main ones that we tend to see is if we were to magnify this section here, there'd be some villi, what we call them. These are finger-like protrusions that help us absorb a lot of vitamins and minerals in the foods that we eat. And what happens when someone with celiac disease eats something with gluten is that these villi can get damaged and flattened, which reduces our capacity to absorb things. And this persistent gut damage is what can cause a lot more health problems for patients further down the line. So really, when we talk about celiac disease, we're trying to keep someone's gut healthy, okay? So when gluten arrives in the small intestine and causes all this host of changes, it also switches on an antibody response, and that's what we're trying to detect with blood tests. So that's why it's so important to eat gluten when you get diagnosed with celiac disease, because actually we're looking for a reaction, your body's reaction to when you eat gluten. And if there's some things there that we can see, then that helps us to diagnose celiac disease. So unfortunately, this is a lifelong condition. For someone who has celiac disease, it doesn't stop, it doesn't cure itself because we have no cure, basically, like many other autoimmune conditions. So all we can tell that person to do and explain to them is that they need to avoid gluten for life. Now, this might sound easy, and a lot of people are aware that gluten we found in wheat, but it's also found in oats, rye, and barley. And for quite a few people, this can be sometimes, not as easy to remember. So what I tend to say to them is, right, just touch your eyebrow, and you can all do that now. And if you just touch your eyebrow, then brow is a really good acronym to remember. It stands for the main ingredients that you'll find gluten in, which are going to be B for barley, R for rye, O for oats, and W for wheat. So I hope that helps. So these are some facts about celiac disease in the UK, but I think it's fair to say that actually most developed countries will have some similar statistics. So celiac disease affects about 1% of the population. So 1 in 100 people have celiac disease. However, we know that in the UK and in most of the countries, it's about 75% of people that are undiagnosed. So we need to get so much better at diagnosing this condition because there's still loads of people suffering in silence without knowing that they have celiac disease. So one of the reasons that this can happen is because celiac disease will have symptoms that are common to other medical conditions. And this is why for a lot of people who think they have IBS, or a lot of people have actually been misdiagnosed with IBS when they had celiac disease. So we know that that's happened with a quarter of celiac patients. They've been told, yes, you have IBS, when actually they had celiac disease. So we need to really screen for celiac disease before we diagnose someone with IBS. And that's really important. Same with other digestive conditions. We need to first screen for celiac disease. On average, it can take about 13 years for someone with celiac disease to get a diagnosis. And this is because, again, the symptoms are common to other conditions. The symptoms might not be so severe, so it might not take that person to visit a health professional, and some health professionals might not be aware of all the symptoms that can come with celiac disease, so it can be quite hard to screen for. And actually, the celiac disease can affect people across the whole lifespan. So you can have people who are diagnosed soon after birth, a few months after in their infancy, or you can have adults or even older adults diagnosed with celiac disease. And in fact, we know that about 50% of people are diagnosed over the age of 50. So it's not something to expect to get diagnosed early in life either. It can happen at any point. There's a higher prevalence with females. So for every male, there's 2 females diagnosed with celiac disease. And the diagnosis can only happen with certainty if you're eating gluten. So if you're not eating gluten, we can't give you a certain diagnosis. So that's why it's really important to understand that sometimes, even though gluten can cause problems and symptoms, it's important, a really important part of the diagnosis process, so we can get the diagnosis right. And we need to also understand that there's a 10% chance of first degree relatives having celiac disease. So if you have celiac disease, there's a 10% chance that your children, your parents, your brothers, sisters can have celiac disease too. So it's important to help them get screened. So there's a bit of a graph here from a research paper, which actually shows that the incidence of celiac disease for all these countries that you can see here is increasing. So Australia is not on there, but New Zealand is. You can see other countries like UK, which have circled there. So the incidence is definitely increasing over time. And what that means is that actually there's more people getting diagnosed with celiac disease. So we need to make sure we're getting the right information to all of these people that are getting diagnosed. Okay, we need to raise awareness of this medical condition. So with regards to symptoms for celiac disease, I think it's important to understand that whilst a lot of people will probably be aware of the common ones like malabsorption, diarrhea, weight loss, failure to thrive in children or stunted growth, deficiencies of certain vitamins and minerals, these tend to be the ones that we associate with the digestive tract, okay, with this ongoing gut damage that we talk about. Celiac disease is obviously a digestive condition, so we'd expect some of these symptoms, but actually a lot of people present with symptoms that are outside of that digestive tract or that people might not expect. So there's things like iron deficiency anemia, then people can have ataxia, which is stroke type symptoms. So you can have loss of speech, coordination, balance. People can have peripheral neuropathy, where they have loss of sensation of the fingers and the toes. People can have osteoporosis, so very weak or brittle bones that can fracture easily. Unexplained infertility, so it might be issues with conceiving, miscarriages too. So these are things that a lot of people would definitely not associate commonly with celiac disease, but can happen. And then there's obviously that abdominal pain too, then dental enamel defects. So sometimes it might be dentists that refer someone to get screened for celiac disease. Bloating, dyspepsia too, which is problems with your whole digestive tract. People can get heartburn, people can get nausea too. So really, and the people can get mouth ulcers too. So really, this is not going to manifest in the way that everybody expects, and that's why the diagnosis is so challenging. And then over on this side too, there's other associated autoimmune conditions and other associated disorders. So dermatitis herpetiformis is pretty much the skin manifestation of celiac disease, where people can get rashes that can blister too, and they can be really itchy, and they can get these rashes around the body. It's usually tends to be kind of elbows, knees, but it can be around the whole body. There's an increased risk of developing type 1 diabetes, another autoimmune condition, increased risk of developing other autoimmune conditions like autoimmune thyroid disease, autoimmune hepatitis, and quite a few here that you can see listed. So that's why for people who have some of these autoimmune conditions, it's important that they also get screened for celiac disease. So it goes both ways, because when you have an autoimmune condition, that can increase the risk of you having other autoimmune conditions. So really what we're trying to look out for here is symptoms and other autoimmune associations, so that we can look out for the health of people with celiac disease. And I think this is a really important diagram to help understand that actually only about, from this research paper, only about a third of people with celiac disease present with these common and digestive symptoms. So that's a really small proportion, whereas we're looking at half of people presenting with neurological disorders, the skin manifestation of celiac disease, dermatitis herpetiformis, osteoporosis, weak bones, anemia. So that's about 50%, and then 21% have no symptoms. So really, these are the hardest ones to diagnose, because that can happen where you have the gut damage, but you just have no symptoms at all. And these people tend to get picked up when we're screening them for something else, when we're checking for other things. So really, we're talking about roughly 2/3 of people not presenting in the way we expect. So as you can probably see, this is why it makes the diagnosis so challenging, and that's why this information is useful for people to empower them so they can continue to pursue a diagnosis or try to at least rule celiac disease out. Okay. Good. So celiac diagnosis in adults. So this is the way that celiac disease gets diagnosed in most countries. Okay, so the UK is a bit different. There's been some new guidance which allows certain patients to be diagnosed only with a blood test. However, in most countries, this is not enough. You need more than the blood test. So at the moment, and I'm pretty certain this is the procedure in Australia too. So people with celiac disease need to be eating gluten. This is absolutely key. You need to be eating gluten. And what's done is a blood test, which is looking for specific antibodies related to celiac disease. So we're looking for some specific antibodies, which can be different depending on what they're trying to monitor. But these antibody tests, if positive, mean that there's an autoimmune response going on, and we need to check more specifically. So the way we check more specifically is sending that patient for a camera test. That basically it's a camera that goes down the throat and into the small intestine. And there you can see here, there's a sample that's taken, and then that sample is looked under a microscope to see if there's actual physical gut damage. And if there's physical gut damage there, and we've got a blood test too, then that is enough to diagnose someone with celiac disease and ask them to start on the gluten-free diet. If you can remember, that is the only treatment we have for someone who has celiac disease. However, the gluten-free diet is not easy to follow. A lot of people think, oh, I just need to avoid barley, rye, oats, wheat, that's fine. But really, it's much more complicated than that. So it's complicated because there's a lot of things that need to happen, and there's a lot of obstacles that need to become overcome. So this is a recent research paper from 2020, which showed by speaking to patients, getting research from other papers too, that really there's all these obstacles that people come across, and these are, you've got the barriers here in red and facilitators to adherence to that gluten-free diet. Okay, so a lot of these barriers, for example, at an individual level, there's a lot of people can have anger about the diagnosis. They might not know what celiac disease is. Some of them might really struggle with the diet. They might find the diet really difficult at an interpersonal level. They might struggle with social activities. They might feel embarrassed when they eat out to say that they have celiac disease. They might find dining at friends' house really difficult because they don't understand the requirements. At an organizational level, it might be hard to find gluten-free foods in supermarkets, corner stores, whenever you're out and about. Dining in restaurants can be really challenging because many restaurants might not understand what they need to do to avoid gluten. Understanding food labels can be a real challenge too. And gluten-free foods, we all know they're quite expensive. So a lot of the labeled gluten-free foods, like bread, for example, is going to be a lot more expensive than regular bread with gluten. At a community level, well, some households might have a lot of people living there. So actually cooking gluten-free can be a challenge. There might be cultural barriers where people don't think that this is a serious condition, or that actually gluten needs to be avoided. That some people might think that gluten needs to be reintroduced. And then traveling too. So if you travel to another country, there's obviously language barriers too, the whole labeling in different countries. So this is complex and complicated for patients. And then at a system level, well, we know that there might be lack of proper knowledge translation. So lack of proper knowledge translation from an organization or from health professionals. You might not be able to access health professionals who understand enough about celiac disease. There's also problems with hospital stays and finding gluten-free food in hospitals, and also all of these symptoms, things not getting recognized, and that patient essentially ending up being admitted to hospital too. So there's all of these complicated things going on, which are going to make the diet not easy at all for patients. So we need to be aware of that. But on the flip side, obviously, these things are overcome. There's other things, all these other factors that can really help to make that diet easier, give better quality of life, and help a lot of these patients. So the reason why the gluten-free diet is so challenging is because actually it takes a really small amount of gluten to cause gut damage. So when we look at food, and I'm pretty aware this is the same, it's the same for Australia, same as the UK. So when we look at food that says it's gluten-free, it's because it has less than 20 parts per million of gluten. Now, this means, that it's a really minimal amount. And for most people, you might be thinking, well, how can we quantify that? What's below 20 parts per million? So hopefully I'll give you a bit of information that might help with that. So we know from research that 10 to 50 milligrams of gluten is enough to trigger gut damage in a day for someone with celiac disease. You might be thinking, right, so what does that mean? So 50 milligrams is the equivalent of 1/70th of a slice of bread. And this is what 1/70th of a slice of bread looks like. So quite challenging to chop up, I can guarantee that, but 1/70th of a slice of bread is essentially too much for someone with celiac disease in a whole day. And therefore, when someone has a food that says gluten-free on it, it has to have way below this, because it needs to be an amount of gluten that you can have, say, 10 slices of gluten-free bread and be fine with it. So actually 20 parts per million is much smaller than this. You can't even see it with the naked eye, which is why avoiding gluten to this level for life is so challenging, because you need to be avoiding not just ingredients, but you need to be avoiding things that have barley, rye, oats, wheat in the cooking process, because cross-contamination can happen where that food touches gluten-free food, and then that's no longer gluten-free. So that's why this diet can be so challenging. And some of the main challenges that a lot of people find following this diet is that, yes, food labels, you've got to constantly be reading them to know what's in the foods that you're buying. There's constant changes, so manufacturers might change year to year some of the products, some of the ingredients. So it's not like you can say, right, I can have this brand of crisps and just have it for the rest of your life. You've just got to be aware of some of these changes. So the price can be 200% more expensive, and this has been shown in research. So actually, there is definitely a price increase with some of these products. So we need to be aware of that, and that can create some challenges for patients. Cross-contamination, as we've talked about. So it's being aware of all of these foods, asking the right questions, and that's on a daily basis. So for some patients, we need to be really cautious, because this can create an restriction, and hypervigilance, where they're this constant anxious state about getting contaminated with gluten, and they might end up over restricting more than they need to. So we need to be aware of these patients, and some of these patients might benefit from psychological help too. So it's all about getting that balance right. And we need to understand that minimal gluten can cause gut damage and symptoms for people. And that's why this can really raise the burden of celiac disease for patients, both at a physical and a psychological level. So when it comes to getting diagnosed with celiac disease, or if you've had celiac disease for a long time, there's a lot of people who might have ongoing symptoms or ongoing problems, or just want to know that they're doing things right. I think this is why it's so important, if you have celiac disease, to make sure that you're doing things right through a dietitian. So as dietitians, we have an evidence-based understanding of celiac disease and the gluten-free diet. So we can help you to make sure you're doing the diet properly. And as this diagram shows here, there are many challenges, and we've talked about some of these associated with the gluten-free diet, like changing your dietary habits, understanding how to read a label, navigating the cost of these foods, feeling social isolation because you can't eat out as much as other people, you can't eat out in the same places. There's cross-contamination too, being aware of it, understanding about reduced availability of some of these gluten-free foods when you're eating out or when you're out and about shopping, and having, getting the balance right with that vigilance and food-related anxiety and that risk of contamination. So all of these things are things that you need to get educated about. And as dietitians, we can help you. So as dietitians, we can really help you get the balance right, help with, if you have other medical issues too, we can help with that within the context of the gluten-free diet. And we can essentially give you the key to flip this over and be able to get the maximum benefits, because I think it's important to say that a lot of people I see with celiac disease, they think they're following the diet, but they're not doing it properly. And that's why they might have some symptoms. They might not be absorbing things properly. So it's really important that you understand how to do this diet properly. And with the dietitian, we can help you to unlock all of these benefits. And that's how you can get the full benefits, including control of these symptoms, seroconversion, which would be reducing those antibody levels, correcting vitamin and mineral deficiencies, so you can absorb calcium, vitamin D, iron, and other vitamins and minerals better. Mucosal healing will refer to that gut damage, so improving that gut health and getting a normal gut structure. The quality of life too, so actually if you're following the diet, you don't have symptoms, that can really help your quality of life. Reducing risk of bone disease, because if you have ongoing gut damage, that can affect the absorption of calcium and vitamin D, and make your bones weaker. So it's really important that the gluten-free diet is followed for that reason. Again, so for health professionals, this can benefit us, that there's reduced healthcare costs if we can keep everybody healthy for longer, but there's a huge benefit for the patient too, because I don't think any patient wants to have to access hospitals more than needed. Increased survival. So we know that for patients with celiac disease, if they're diagnosed and treated, that can really help things. Same with decreased risk of cancer. So if there's ongoing gut damage in someone with celiac disease and they're not following the diet, then that can increase the risk. The risk is small, but it can increase the risk of cancers like small bowel cancer. So really, all of the complications associated with ongoing gut damage can be improved, and almost to the point of someone healthy if you're following the diet, and if you have celiac disease and you're following the diet properly for life. So that's why it's really important that this is understood as a permanent diet, and that you have regular checkups as needed, and that if in doubt, you go to a dietitian, you can go to a gastroenterologist, a general practitioner, a health professional, to just make sure you're doing things right. So overall, what can you do to help yourself and to help others? So I think if in doubt, it's so important to get tested for celiac disease. This needs to be ruled out to make sure that it's not causing your digestive and even non-digestive symptoms. So we talked about things like neurological conditions. We talked about headaches, fatigue, even small symptoms like that, when people are like, they're just bizarrely fatigued, more fatigued than they should be, and it's just worth getting checked for celiac disease. And you, hopefully your health professionals will be screening that, but it's important that as a patient, you also bring this up and say, I don't know, I would like to get screened for this. So first degree relatives of patients with celiac disease or people with celiac disease, so there's a 10% chance of them having celiac disease, so it's important to get them screened. Then I'd also say that people who have celiac disease, I often see them and they've had symptoms for a really long time despite being on the gluten-free diet, and they think it's normal. They think, oh, it's just my celiac disease. This isn't normal. So if you have celiac disease and you're following the diet, most people, the symptoms should resolve and you shouldn't have any symptoms. Now, if you still have ongoing symptoms, that's why we need to explore that, because there's a really small percentage of people with celiac disease that actually don't respond to the diet and might need some medical treatment. So we need to identify if you're one of them. If not, what we can do is have a look and see if there's anything else causing your symptoms. So some people might have IBS or IBS type symptoms. Other people can have completely different conditions where they might not they might not be absorbing things for another reason. They might have another autoimmune condition that's causing digestive symptoms. So we really need you to come forward and say, look, I've got ongoing symptoms. So we can first identify if you're following the diet properly, and if you are, we need to do some more checks. Okay. That's why it's really important that you actually get help from qualified health professionals like dietitians and gastroenterologists who really understand this condition and can help you in the right way and signpost you towards things that might help. So signpost you towards the right tests or other health professionals that can support you. And I think it's really important to understand that such a restrictive diet is not easy. And I think, you know, for whether you have celiac disease or not, and you're listening to this, I think it's really important to understand that no patient with celiac disease is doing this voluntarily. No patient with celiac disease is trying to call attention in a restaurant, or they're not trying to make a fuss out of things. They don't really have a choice because there's no other treatment for this diet, for this condition. So it's only the gluten-free diet. And that's what's and the gluten-free diet needs to be followed with that level of restriction. So that's why they'll say things in restaurants. They'll ask how things are cooked. They might come to your house and ask you how you're preparing things, because actually they need to avoid gluten to that level to stay healthy. So it's really important that we understand that, so we can empathize and support these people, because this diet is definitely not easy to follow for life. So I hope that helps both people with celiac disease to be more understood and people without celiac disease to understand those with celiac disease better. So these are a few references if anyone's interested, which I've mentioned throughout the presentation. And I just want to say big thank you again for inviting me to speak and to help raise awareness of celiac disease. And for anyone who wants a bit more information, or information that I share, I'm quite active on social media trying to raise awareness of celiac disease on there too, and other digestive conditions. So on Instagram, it's at celiac dietitian, and on Twitter, it's Cristian Costas Batlle. So thanks again, and I hope you enjoy the rest of your day.